Okay, we're going to cover Chapter 35, which is Acquired Problems of the Newborn. Here are your learning objectives. We'll start out talking about acquired problems of the newborn, and acquired problems refer to those conditions resulting from environmental rather than genetic factors. So we've covered some of the genetic complications, but this is complications that are from the environment that the baby's surrounded by. The focus is on the following: birth trauma, infant of the mother with diabetes, neonatal infections, effects of maternal substance abuse on the fetus, and effects of maternal use of caffeine and antidepressant medications on the pregnancy, during the pregnancy. Birth trauma is the physical injury sustained by a neonate during labor and birth, with an incidence rate of about 2.9 per 1,000 live births. So depending on where you're doing clinicals, that you're at some rather larger facilities that probably have 2,000 births per year, that means four to five infants per 2,000 births at the hospitals where you're doing clinicals will experience some type of birth injury. Some birth injuries are avoidable, but some are unavoidable despite skilled and competent obstetric care. So, for instance, shoulder dystocia, there are risk factors, but we cannot predict it. So even though you have the best nurses and the best physicians, sometimes you have a birth trauma that nothing could have prevented it, there's nothing you could have done or known about ahead of time to prevent it. Now, hindsight is always 20/20, where the woulda, coulda, shoulda, but we can't take that into account. Care of the infant with a birth injury is individualized based on the type of injury, and we're going to go through those. So, back to the unavoidable versus risk factors. So, we now have ultrasound to diagnose macrosomia, hydrocephalus, and unusual presentations. And we even do elective C-sections for selected pregnancies to prevent birth injuries, and that includes some of those with those risk factors. Birth trauma risk factors include maternal age of less than 65 or greater than 35, if it's your first baby, if you have any type of uterine dysfunction, so if you have a prolonged or a precipitous or fast labor, if your baby's preterm or postterm, cephalopelvic disproportion, oligohydramniosis, which is too little fluid, macrosomia, which is a big baby, multifetal gestation, abnormal or difficult presentation, and different birth techniques. So first we're going to talk about soft tissue injuries, going to kind of list them. These were covered in the previous chapter, so I'm not going to repeat these. Erythema or bruising, petechiae, abrasions and lacerations, edema, forceps injury, and accidental lacerations. So if you want to look back to your previous notes, there's really nothing additional to add from this chapter. Additional soft tissue injuries are injuries of the eye and retinal hemorrhage, caput, cephalohematoma, and subgaleal hemorrhage. Okay, now let's talk about skeletal injuries. The newborn's immature, flexible skull can withstand considerable molding before fracture results. Skull fractures are common in infants with a cephalohematoma, so if they have a cephalohematoma, you can not assume, but you can, if a baby has a skull fracture, they usually have a cephalohematoma to go along with it. So the first type of skull fracture we're going to talk about is a linear fracture, and this is most common in the parietal bones. It requires no treatment. The second are indentation fractures, also known as ping pong ball. They can occur during difficult births for pressure on the fetal head against the maternal bony pelvis. Also from forceps deliveries. A lot of times they'll order a CT scan to rule out bone fragments and brain tissue injury. Sometimes surgery is needed, but it was interesting to read in the book. I had never heard of this, but the use of a manual breast pump or a vacuum to reduce that fracture. So you're kind of sucking the indentation back up. So really around the skull fractures, the skull itself, you're not going to harm it. You just have to worry about the soft tissue injuries to the brain if there are skull fractures. Okay, the next fracture we're going to talk about is the clavicle fracture. It is the bone most often fractured during birth. It's usually fractured and the break is usually in the middle third of the bone. It occurs during difficult delivery of the shoulders with vaginal delivery or extension of the arm during a breech vaginal birth. Vacuum deliveries or if the baby weighs greater than 4,000 grams. Signs and symptoms of a clavicle fracture include limited movement on the arm that's affected, crepitus over the bone that's affected, and an absent Moro reflex on the affected side. I hope your clinical instructors were able to cover the normal newborn reflexes and a gestational age assessment in clinicals this week, so you would know what an absent Moro reflex would look like. Treatment includes careful, gentle handling of the infant, so really that's the only treatment involved. Next is the humerus or femur fracture. Immobilization may be necessary, and fractures in newborns, luckily, just tend to heal rapidly. Parents need support. They are very hesitant to take care of newborns as it is. They don't want to hurt them, and then if there's anything wrong with the baby, such as a fracture, then they need extra support that, babies heal well, it's not causing pain, if that's true, that they need to, be careful with their baby, but enjoy their baby just as they would as if it didn't have a fracture. This first shows an x-ray. On the right side you can see a fractured clavicle after a shoulder dystocia delivery. And on the right is a brachial plexus injury. So you can see the infant's right arm. You can see how limp it is. So now we're going to talk about peripheral nervous system injuries and the different type of paralysis that can occur. So this picture is a facial paralysis after a forceps birth. You can imagine how if that was your baby it would be very concerning. The good thing overall about most of these nervous system injuries is the babies heal just fine. So the first type of injury we're going to talk about, brachial plexus injuries. There are 3 of them listed there, and so we'll just kind of talk about overall the brachial plexus injuries. Risk factors include difficult birth, shoulder dystocia, birth weight greater than 4,000 grams, a vaginal breech birth, forceps or vacuum delivery, maternal diabetes, or a prolonged second stage of labor when they're pushing. The first type of brachial plexus injury is we're going to talk about the Erb Duchenne palsy, and this is damage to the upper plexus. So it involves nerves C5 and C6 and is caused by stretching or pulling the head away from the shoulder during a difficult birth. The arm hangs limply beside the baby's body. The shoulder and arm are adducted and internally rotated. The elbow is extended, the forearm is pronated, the wrist and fingers are flexed, and one difference here is the grasp reflex may remain intact because of what's affected. So that's a difference here, that the grasp reflex may remain intact. Next is the Klumpke palsy, and this is damage to the lower plexus. So the wrist and hand are flaccid, the grasp reflex is absent, deep tendon reflexes are present, and there tends to be dependent edema and cyanosis can occur. Treatment for the brachial plexus injuries includes intermittent immobilization across the upper abdomen, proper positioning and range of motion. If edema or hemorrhage is present, it could cause paralysis, but the prognosis is good, and a full recovery is expected in most infants. And if you look on page 854 in your book, there shows a picture of a baby with the damage to the upper plexus, or the Erb da Vinci palsy. Next, we're going to talk about the pharyngeal nerve injury. It is a component of brachial plexus injury rather than an isolated problem. So usually it's multiple. The injury is a result of traction on the neck and arm during birth. There's usually unilateral and results in diaphragmatic paralysis. And the diaphragm is what we breathe with. Cyanosis and irregular thoracic respirations and no abdominal movement on inspiration are signs. They require ventilator support, and sometimes surgical correction may be necessary. So that's a much more severe nerve injury. And the last nerve injury we're going to talk about is the facial paralysis or palsy. It's caused by pressure on the facial nerve. Risk factors include prolonged second stage of labor and a forceps birth. The face on the affected side is flattened and unresponsive to grimace when crying. The eye on the affected side remains open, but it usually resolves within hours to months. Treatment is to assist with feeding and prevent damage to the cornea of the open eye. So, usually they're taping it shut or putting moisturizing cream in it, but you don't want to cause damage to the cornea. Next, we're going to cover central nervous system injuries. First, we're going to talk about intracranial hemorrhage. It's a result of birth trauma in a large infant, and the newborn often has more than one type of hemorrhage. The first type of hemorrhage is a subdural hemorrhage or hematoma. It's usually present with apnea, unequal pupils, a tense fontanelle, seizures, and even a coma. There's a collection of blood in the subdural space. Risk factors include first baby, precipitous labor and birth, difficult forceps birth, or an LGA baby. The second intracranial hemorrhage is a subarachnoid hemorrhage. It occurs in term infants as a result of trauma and preterm infants as a result of hypoxia. The bleeding is venous in origin, and signs and symptoms vary considerably. They can even be absent. There can be altering from depression and irritability in the baby. They can have seizures or even apnea. Treatment is supportive and includes IV therapy, observing and managing the seizures, preventing increased ICP, and minimal handling. You just don't want the baby to cry. You don't want them to be irritable. And then we're going to talk about the last thing for the central nerve injuries is spinal cord injuries. And its most common cause is a difficult breech birth. Risk factors include shoulder dystocia, a brow face presentation, dystocia, preterm birth, somebody who's never had a baby, or precipitous birth. Signs and symptoms depend on the severity and location of the injury, so depend on what part of the spine is injured, and ranges from respiratory deterioration to paraplegia and even death.